So yes, I presented data from an ongoing phase 1 clinical trial of Botensilimab, which is a next generation CTLA-4 inhibitor, with or without Balstilimab, which is a PD-1 inhibitor. And this phase 1 study has enrolled to date more than 400 patients with a variety of advanced solid tumors, including tumors that are thought to be immune cold, such as microsatellite stable colorectal cancer. And so we presented the data for several expansion cohorts over the past year, including at SITC last year. But what we're really interested in is there's a dedicated expansion cohort for sarcomas, which are a high unmet need, and only about 15 to 20% of these tumors will actually respond to immunotherapy at all, and most tumors are very, very cold and thought not to respond particularly well. So one of the things with the next generation design of Botensilimab is that there's FC enhanced structure, which allows for it to bind more tightly to activating FC gamma receptors on antigen presenting cells and natural killer cells, which makes a tighter immune synapse and is thought to improve T cell priming, activation, and expansion to help it work better in cold tumors that might not normally respond to immunotherapy. And so in this study, what I presented at ESMO and then at CTOS were 41 evaluable sarcoma patients who'd been treated as of about April of this year, and then had imaging assessments to be evaluable. And so what we were excited to see is that there was an iRECIST response rate of 20% and 17% RECIST confirmed response rate. And we were really excited because we had enrolled an additional 16 patients with leiomyosarcoma, which is thought to be one of the coldest sarcoma subtypes. And when we looked at the responses, we saw responses not only in immune hot subtypes like angiosarcoma, which we would have expected, but also saw activity, including stabilization of disease and some responses in leiomyosarcomas as well as other cold subtypes. And then when we looked at progression-free survival and sort of the durability, many of these patients had prolonged stable disease or responses that were durable, so that the 6-month progression-free survival rate was estimated to be about 40%, and the median duration of response about 19 months. So if they responded, they did so durably and deeply. So in any case, we're really excited to see these results. We're still enrolling to this expansion cohort and hoping that this continues to be an effective treatment for these patients with such high unmet need.